Okay, so today our first topic is congenital hypothyroidism, and first of all, we have to clear the definition of what is congenital hypothyroidism. So basically, congenital, it is a term which is used. You can say for a condition which is present at birth. So the condition which is present by birth, we usually call it is congenital. And hypothyroidism, basically, hypo, it is a term used when the hormone level is low in your body. So hypo mean low, and thyroid mean these are the thyroid hormones which are going to produce from the thyroid gland. And ism, basically, it is a term used for condition. So hypothyroidism, it's mean a condition in which your thyroid gland is going to make less or little thyroid hormones. It is called hypothyroidism. And if that condition is present by birth, we call it congenital hypothyroidism. So this is the definition of congenital hypothyroidism you have to remember. Then after that, before starting this topic in detail, we just we will go just back in physiology and try to understand the regulation of thyroid hormone, like how the thyroid hormones are regulating in our body. So let's suppose this is the picture of hypothalamus in the central nervous system, and below the hypothalamus we have the pituitary gland. And you guys have to remember this: the signal is going to start first from the hypothalamus. Hypothalamus is going to release the thyroid releasing hormone. This thyroid releasing hormone will travel and go to the interior pituitary. And in the interior pituitary, we have different kind of cells, but the cells which are going to produce the, you can say, TSH, those hormones are called thyrotropes. So in the interior pituitary, we have the thyrotropes. So TRH that is coming from hypothalamus, it will go and act on those thyrotropes, and those thyrotropes will release the TSH, thyroid stimulating hormone, and that hormone will go and, you can say, it will stimulate the thyroid gland. And when the thyroid gland is stimulated, it is going to produce T3 and T4. So this is the, you can say, the normal feedback, you can, normal regulation of thyroid hormones production in our body. You guys have to remember this, because this is the normal physiological pathway we have to understand first of all these things. So that's all about, you can say, about the regulation. But we just have to also focus on one more important thing. Like thyroid hormones are, why they are important in our body, especially if we are talking about the condition which is present at birth. So in babies, why they are important? So anyone from all of you can mention the three or four function of thyroid hormone. What are the most important function? Because if you don't know the function, definitely you will not know the clinical presentation that will be happen when that hormone is absent. So first of all, the first most important function, it is important for brain maturation. So it is important for brain maturation. Then the second important function, it is important for linear growth of baby. So it is also important for linear growth of baby. So this is the second important function. And third important function, it is required for your organ maturation. And that point we will see, especially when we are going to discuss the clinical features. So just remember, this is the function of thyroid hormone in babies. In adult also, it is going to, you can say, participate in organ maturation. So these are the three important function. And also please remember, there are a lot of function. It is going to, you can say, maintain the basic metabolic rate also. So these are the some important function you just have to remember. And after that, if they are going to ask, if, let's suppose, if the baby is not having T3 and T4, now you can see like that baby is going to suffer from delay delaying of brain maturation. That baby growth will not occur. And also very very important, your organs are not going to be mature, and your basic metabolic rate is also not good. So these are the important function you first have to remember and understand before going in detail of that topic. So these are the important, you can say, physiological functions of thyroid hormones. Please remember all these important function. Then after that, we have to understand the causes, because we have already discussed here the congenital hypothyroidism, it is a condition which is present by birth. So now we have to understand like what are the causes that are usually present at birth, and they are going to, you can say, lead to hypothyroidism. So first important cause is thyroid dysgenesis. So thyroid dysgenesis, basically you have to understand first of all its definition. What is thyroid agenesis? Sorry, dysgenesis. So thyroid dysgenesis, basically it is a term used when the thyroid gland did not form normally. So when the thyroid gland is not going to form in your body, it is called dysgenesis. And we have different type of dysgenesis, like it can be agenesis. This is the first type of thyroid dysgenesis. Then also we have like thyroid hypoplasia. We will go in detail of each like term. Just try to like learn first of all these different terms. And another important term we have thyroid ectopy. So all these are the types of thyroid dysgenesis. So just remember this point. First of all, most cases of congenital hypothyroidism are due to thyroid dysgenesis. And what are the types of thyroid dysgenesis? Thyroid agenesis, hypoplasia, and ectopy. So first of all, what is the meaning of agenesis? So just remember, when the thyroid gland is completely absent in your body, when the thyroid gland is completely absent in your body, it is called agenesis. A mean absent, and genesis, basically it is a term used for formation. So when the thyroid gland is totally absent, we call it agenesis. And what is the meaning of hypoplasia? Now, now let check the difference between agenesis and hypoplasia. In agenesis, thyroid gland is totally absent, but in hypoplasia, thyroid gland is present, but it is, you can say, performing less function. It is too small. So that is why it is like called hypoplasia. And another important term is ectopy. What is the meaning of ectopy? Like the thyroid gland is present in the wrong place. Normally, thyroid gland is present in the neck, but if it is present under the tongue, it is a type of ectopy. So all these are the types of thyroid dysgenesis. So please remember these different types of you can say thyroid dysgenesis. And then we have the other important cause which is called dysharmogenesis. So what is the meaning of dysharmogenesis? Basically, it is a term used when in your body the thyroid hormones are not going to be produced. So when the defect is present in the formation of T3 and T4, it is called dysharmogenesis. Now we have to again understand what are the examples in which your thyroid gland is not going to make the thyroid hormone. So first of all, you have to remember in the thyroid gland we have one enzyme. That enzyme is called thyroid peroxidase, TPO. This enzyme is very important. You can say uh, formation of for the formation of T3 and T4. So let's suppose if the person is having deficiency in this enzyme TPO, thyroid peroxidase, so your body is not going to make the T3 and T4. So definitely it is going to lead hypothyroidism. Then also very important point, uh, can you guys mention the name of those drugs which can lead to hypothyroidism in baby? Anyone from all of you can mention the name of drugs. Let's suppose they are going to give a question to you, like a female came to you, and this female is suffering from hypothyroidism, and that female is taking especially these kind of drugs when she is pregnant, but the baby which born to her is suffering from congenital hypothyroidism. So what are the drugs that might be that female can be taking? So good. So for example, if you are taking the PTU, propyl thiouracil, then also methimazole. Methimazole. These are the anti-thyroid drugs. So if the person is suffering from hypothyroidism, definitely we are giving these drugs. But you just have to remember these drugs can cross placenta, and they will affect the like thyroid hormone since in the baby. So this is the important point. Like you have to remember these are the different drugs which can lead to you can say different types of problem in the baby. So that's all about the dysharmogenesis. So these are the two important examples which you have to remember, like thyroid peroxidase deficiency, and also we have the example of drugs. Then also very important cause which can lead to dysharmogenesis. What is that cause? For the formation of T3 and T4, we need iodine. And let's suppose if the pregnant, if a female is having iodine deficiency, then definitely baby is not going to get iodine. So in that case, it can also happen like baby can suffer from hypothyroidism. So iodine deficiency in mother can automatically lead to hypothyroidism in baby also. So these are the you can say the important causes which come under the category of maternal causes. So these are the important point you have to remember. In maternal causes, you just have to remember the drugs. You just have to remember also, especially the iodine deficiency. And also very important point, if the female is suffering from like any kind of autoimmune disease, so that autoimmune disease can also you can say lead to problem in the baby, because these antibodies are going to cross the placenta and they will lead to hypothyroidism in baby. So these are the maternal causes you have to remember. Then the very important point here, it's by mistake, please correct this. It is not congenital, it is central. So here it is central. So central pituitary and hypothalamus defect. So we have to understand like how these problems can lead to congenital hypothyroidism. As we already discussed, the thyroid hormone regulation is going to start from hypothalamus. Like hypothalamus is making TRH, that TRH is going to anterior pituitary, that will make TSH, and that TSH is going to the thyroid gland, and that thyroid gland will produce T3 and T4. Now let's suppose if the person is suffering from any kind of a disease which is affecting the hypothalamus. So if the hypothalamus is not working, TRH is not going to produce. If TRH is not going to produce, TSH is not going to produce. And if the TSH is low, definitely you can't make T3 and T4. So it will lead to hypothyroidism. Now, very important point. We have to differentiate the hypothyroidism types. Like we have two main category of hypothyroidism. One is primary hypothyroidism, and the second is secondary hypothyroidism. So these are the and primary hypothyroidism or secondary hypothyroidism can happen in baby. So it can lead to, you can say, congenital hypothyroidism, which is also called cretinism. Cretinism is another term which is used for congenital hypothyroidism. So primary hypothyroidism and secondary, what is the difference in between these two terms? So just remember, if the problem present inside the thyroid gland, but hypothalamus, pituitary gland, everything is working fine, so that is a, you can say, the example of primary hypo. Primary mean the defect is primarily present in the thyroid gland. But what is the example of secondary? Secondary mean the thyroid gland itself is normal, so it is mostly the problem present outside the thyroid gland. And the one example which I gave to you, like if the person has a problem in the hypothalamus, so problem in the hypothalamus definitely can lead to low TRH. If the TRH is low, definitely TSH is low. If the TSH is low, you are not going to make T3 and T4. Same like that, if the person is suffering from you can say pituitary ischemia or pituitary infection, so in that case your TSH is not going to produce from pituitary gland. So in that case, when the TSH is not going to produce, again your thyroid gland is not going to be stimulated and it is not going to produce T3 and T4. So now they can also ask from you, like how we can differentiate the problem is present in the hypothalamus or in the pituitary. We have to see the hormone level. Let's suppose if the TRH level is high and the TSH level is low, T3, T4 is low. So you guys let me know, like what where the problem is present. The problem is present inside the hypothalamus, pituitary, or thyroid gland. Where the problem is present. Let's suppose they give you these values of TRH. TRH is increased, but TSH is low and T3, T4 is low. So in that case, the problem is present in the pituitary gland. But let's suppose if your TRH is also low, if your TRH is also low, then your TSH is low and T3, T4 is low. It is the problem which is present in the hypothalamus. So that's why they can give you a clinical case. Like a baby came to you, this baby is suffering from flam symptoms, but you have to tell the cause. The cause they can ask from you, like it is primary hypothyroidism or secondary. So thyroid dysgenesis and dysharmogenesis, they can lead to primary hypothyroidism, because these are the problems which are present inside the thyroid gland. They are not going to be present outside. And but the problem in the pituitary and the hypothalamus, that can lead to secondary hypothyroidism. So these are the, you can say, important points which you have to remember, especially related to cause. Please let me know if any student didn't understand anything. Till now everything is clear to you guys? Like first of all, what is hypothyroidism, then uh, what is the primary and secondary hypothyroidism, then what are the causes. You have to remember all these causes because they are going to be they can like show up in your exam. So don't like try to learn everything. uh, Try to have a strong concept on everything which you are going to study. So that is the purpose of our class basically. Okay, so now we are going to discuss the clinical features, like what are the clinical symptoms can be happening in a baby, especially if that baby is suffering from hypothyroidism. So the first clinical feature which the baby has, that is jaundice. Now just remember, like during my classes I am not going to simply read this clinical feature. We have to go in detail. Let's suppose if the baby is suffering from jaundice, from hypothyroidism, what is the mechanism behind this clinical feature? We have to understand the pathophysiology, because in step one definitely it is going to be tested. So first of all, you guys have to tell me the normal, you can say, let's suppose two babies you have. One baby is not suffering from hypothyroidism, he is healthy, and the other baby who is suffering from hypothyroidism, and that baby is showing the signs of jaundice. So first of all, we have to understand the normal, like why this baby is not showing the sign of jaundice. First of all, definitely this baby is not suffering from hypothyroidism. His T3 T4 levels are normal. So in your body, T3 T4 is going to perform two basic function. First function, it is going to help to mature the liver enzyme. So its one important function is liver enzyme maturation. Liver enzyme maturation, this is the first important function. Then the second function is T3 T4 is going to help in bilirubin metabolism. So these are the two important function you have to remember. Now imagine, let's suppose if the baby is not having T3 and T4, what will happen? If the baby is not having T3 and T4, like your liver enzymes are not going to mature. If your liver enzymes are not going to mature, what will happen? Your liver enzyme, the main function of liver enzyme, they will convert the unconjugated into conjugated form. So if the liver enzymes are not working, they will not convert the unconjugated into conjugated, so it will lead to hyperbilirubinemia, that is like probably unconjugated. And when your bilirubin level is up, you will have the jaundice. Same like T3 T4 are going to help in metabolism of bilirubin. So when your body is suffering from especially hypothyroidism, so T3 T4 are not present, then bilirubin is not going to be metabolized. So what will happen? Again, the bilirubin will level will increase and it will lead to jaundice. So that's all about jaundice. You have to remember. Everything clear to you guys? My voice is clear. Please let me know first of all, because might be sometime the network problem can occur. So whenever my voice is disrupted or you guys are unable to understand, please highlight that point, because this class is going to be recorded, and it is for you guys, which you can also remember. It can take after on. Sure, no worries. You can let me know whenever it is going to break. I will try to repeat that point again. Okay, so the next symptom, which is the baby having, that is like lethargy. So lethargy, and also sometime the term used for it is hypotonia. Hypotonia and lethargy. These are the two important clinical feature the baby might show. Hypotonia, and it is also called floppy baby. Floppy baby mean the baby muscle tone is very low. Now again we have to go in pathophysiology of this symptom. So first of all, the thyroid hormones, they are very, very necessary for two important things. First, they are very important for muscle tone. If in your body the muscle tone is like good, it's mean T3 T4 are working good. And the second important function, they are going to play an important role in neuromuscular junction development. So these are the two important function: neuromuscular junction development and also muscle tone. Now let's imagine if the person is having low T3 and T4. So if the T3 T4 is low, definitely your muscle tone is not going to your muscles are not going to be strong. Your muscle strength will decrease, and also your neuromuscular junction are not going to perform well. So if your muscle tone is not good, your muscle tone will decrease, it is called hypotonia. And that can lead that is also like a look like the person is lethargic. It is also called floppy baby. So floppy baby, hypotonia, these are all are the terms which are used for this concept. So just remember these point. And also you have to remember whenever the baby is suffering from hypothyroidism, because T3 T4 is required for brain maturation. If T3 T4 will be low, definitely your brain is not going to develop. Automatically that person is like lethargic, or you can say lazy. And other important clinical feature is constipation. Like why the baby is going to get constipation. So first of all, just remember T3 T4 level. T3 T4 levels are very very important for GIT mortality. So if you want to have good GIT mortality, you need T3 T4. But in case of hypothyroidism, baby is not going to have T3 and T4. His GIT mortality is not working, so it will lead to the constipation. So just remember that point. And the other important symptom is like large fontanelles. So first of all, again, just remember thyroid hormones are very important for brain growth and maturation. So when you have low T3, T4, your bone ossification is going to be delayed. Your bone ossification is not going to occur. So when your bone ossification is not going to occur, your like frontales become larger than normal. Your like bones are, you can say these frontales are not going to close, because if you want to close these, if you want to like have a good bone ossification, you need T3 and T4. So if T3 T4 is not present, your like bone ossification is delayed. Your frontales are going to be large, they are not going to close at a time, like on a time, sorry, on a time. So that's why the baby has large interior fontanelles. Then the other important symptom is macroglossia. Why baby tongue is large? And also I have like enter a picture for you guys. You can see here the tongue protrusion. Basically the tongue is so large, it is coming outside of mouth. So first of all, just remember when like why it is happen, the baby suffering from hypothyroidism and microglossia. So first of all, just remember when the T3 T4 is low, uh, hypothyroidism can lead to accumulation of a different kind of, you can say, polysaccharide, like mucopolysaccharide. And those mucopolysaccharides are going to like accumulate, and where they are going to accumulate, they will like cause mixed edema, they will cause tissue swelling. So that's why the size of the tongue is going to be enlarged. So that is a reason like behind this. So this is an important point you have to remember with like pathophysio. Then we have the puffy face. Why the baby face is going to puffy? Because you just have to remember like when your T3 T4 is low, you are like these mucopolysaccharides are going to be accumulated, and when they are going to be accumulated, they will draw the water. So when they will draw the water into tissues, especially this swelling is going to occur around the eyes. So you will see like puffy eyelids, like full cheeks. Then the baby is suffering from swelling also. So the puffy face, basically you can say it is a term used for swollen face, you can say. So these are the, you can say, important point related to puffy face. Then we have the umbilical hernia, very very important point. First of all, we have to understand why baby is going to have this umbilical hernia. So just remember, abdominal wall muscles. If you want to have like a good abdominal wall muscle, you need T3 and T4. So when the hypothyroidism will occur, the abdominal wall muscles tone is going to decrease. It will lead to hypotonia. So when your abdomen muscles are weak, then definitely in, let's suppose if your muscles are going to weak, then anything can protrude out from that weak area. So that's why when your abdominal muscles become weak, then your gut is not going to stay inside, it can protrude out. That can lead to umbilical hernia. It's like the content are coming out through umbilical region. So this is the important point you have to remember. Then the baby cries hoarse. You have to remember this point. The baby cries hoarse, again why? Because the baby tongue is enlarged, baby has laryngeal edema, baby has hypotonia. That will affect the vocal cord. So when your vocal cords become thick, you can say your voice is going to be low pitched. So the baby will cry like horse cry. We use this. So just remember, it is a rough deep cry, which may be like weaker or softer. And other important symptom is like intellectual disability, and this is something like they really want to know for your exam, because this is the preventable cause of intellectual disability. Like if the baby has T3 and T4, you can prevent from this condition, because if the baby is going to have intellectual disability, it is a lifelong problem. Like if your brain is going to be, let's suppose the neurons are going to be dead, you cannot recover those neurons. So just remember, if they ask from you like what is the most common cause of preventable like intellectual disability, so it can be like congenital hypothyroidism. So that's why you just have to remember this important point. So all these are the clinical symptoms you will see in case of hypothyroidism. Then after that, we have to go for diagnosis. So diagnosis is very simple. Nowadays in the especially developed countries like US, sometimes we are using we are doing the newborn screening. We are like checking the level of T3 and T4. So if the T3 4 is level low, definitely it can give you idea of hypothyroidism. So you just have to remember, like we have to do the newborn screening, we have to check the T3 and T4 level. So that's all about the diagnosis. And what about the treatment? Simply the thing which baby don't have, give it from outside. Like the baby is suffering from hypothyroidism, give him levothyroxine. So just remember this, and please avoid this levothyroxine with soy product, iron and calcium. And this is the MCQs which I get when I go for USML step 1. Like he give the question like that a person is like the age of person is approximately 60 and 70, in between this, and person has thyroidectomy, and he is taking levothyroxine, and with the levothyroxine he is also using some kind of supplements, but the person is showing the signs of hypothyroidism, like he's taking the dose properly, but the problem is that dose is that dose is taken with some kind of supplements, so like these iron, calcium, soy products. So they ask about the pathophysiology, like what is the mechanism behind this reason why the person is still showing the sign of hypothyroidism, instead like he is taking regular doses of levo. So the main problem in that is because these supplements are going to impair the absorption. They will impair the absorption of like levothyroxine. That's why even if you are taking in proper dose, if you are taking the supplement with that, it is going to lead to impairment. So that is the like question which I get when especially when I go for step 1. So that's why please remember this point for your exam. So that's all about this topic. Now let me know if you guys have any question related to this topic, like if you have any question related to cause, clinical feature. If you didn't understand any clinical feature, let me know so that I can repeat. Otherwise we will solve this question. We will take this review from your, then from the first aid, and all these things are going to be combined now. These are the things which you have to like when you're using the solo your, definitely you will get this. So please let me know if you guys have any question. Otherwise we're going to solve this question. So okay, so this is the question. Anyone from of all of you can read this question just for me? Anyone from all of you can read this question? If it is not visible to you, please let me know. I can also zoom this. Okay. Anyone want to participate? Why you guys are so silent? Isn't it interesting to you? For you guys? Or you guys are boring? Please let me know. Okay, so the question is like we have 2 month baby. We have 2 month old boy came to emergency department, and that baby is showing the signs of floppiness and poor feeding, floppiness, and the infant was born in Eastern Europe via uncomplicated vaginal delivery to a 38-year-old woman, and she migrated to US with his family. The parent described the infant as good baby who rarely cries. Rarely cries mean the baby cry is isn't it crying, or if he's crying, it is very like softly, and sleep throughout the night, but has lately been difficult to rose for breastfeeding. Stool have also decreased to every other day, and are small and pellet like. Why the stools are decreased? Because baby is showing the sign of constipation. Physical examination: hypotonic infant, large interior fontanelle, large tongue, reducible umbilical hernia. He has low tone, unable to hold his head, and no abnormalities are seen. Which of the following is cause of this patient condition? So you have to pick the cause, like botulinum, Down syndrome, galactosemia, high sprung, hypothyroidism, and phenylketonuria. So as every clinical feature I already described in lecture. Like here, baby is showing the sign of hypotonia, umbilical hernia, large tongue, large interior fontanelle. The baby is showing the baby is also floppy. So these are the classic clinical features of hypothyroidism. Now, this is the very important point. Whenever you are solving the U word, even you get the question right, please don't leave other options without reading or without understanding. Like why this baby is not having botulinum. So what is the reason? So just remember, especially the large interior fontanelle, umbilical hernia, and then also the macroglossia, these are not going to occur in botulinum. So these are the classical feature for hypothyroidism. Then we have Down syndrome. In Down syndrome, we have other like a physical, you can say dysmorphic feature, very important. Like the baby has a upslanting palpebral fissure, epicanthal fold, single palmar crease, and these dysmorphic features are not given here. So definitely it is going to be wrong. Then we have galactosemia. Galactosemia, basically, you just have to remember these babies especially have jaundice, vomiting, or their liver is going to be enlarged, especially when they breastfeed, because in the breast milk we have galactose, and this is a condition which is related to galactose metabolism. So that's why it is called galactosemia. So here there like question is not telling the symptoms are going to occur after breastfeeding, so that's why it is not going to be right. Then Hirschsprung disease, we just have to remember Hirschsprung disease, basically it is usually caused by, you can say, the defect in neural crest cell. So defect in the neuronuclear cell, and two classical symptoms of Hirschsprung disease. First one, the baby is not going to pass meconium. The second, baby is having bilious vomiting. So these are the two classical symptoms which they will tell you in exam. Like these babies are not showing macroglossia, fontanelle is large, umbilical hernia. These are not like typical for Hirschsprung disease. And then we have phenylketonuria. Again, phenylketonuria can cause intellectual disability. Hypothyroidism can cause intellectual disability, but we have to differentiate from other symptoms. Like what are the other symptoms? So phenylketonuria, it is like it will cause a musty body odor. It will cause the light, you can say, pigmentation. So here no such symptoms are like described. So let's now take the view of this information. So congenital hypothyroidism usually asymptomatic at birth, rarely caused delayed meconium passage. No, this is the important point. Why those babies who are suffering from hypothyroidism, they are asymptomatic at birth? What is the reason? The basically when the baby is going to be born, the mother's maternal T3 T4 are present in the body of the baby. That's why when the baby born at birth, he is usually asymptomatic. But after a few weeks to month, when the maternal thyroid hormones are going to be finished, the baby will show the signs of hypothyroidism. So lethargic, poor feeding, fontanelles, enlarged tongue, puff face, umbilical hernia, constipation, jaundice, dry skin. Already I have explained all these things. How we will make diagnosis? We will newborn screening, and we will see the labs like TSH and free T4. No, they can also ask question from you guys, like from the diagnosis. If the baby has TSH increase, it's mean it might be problem present in the thyroid gland. So if the TSH can also be low. It is not like uh, going to be 100%. Like in case of congenital hypothyroidism, your TSH is increased. TSH can also be low, or TRH can also be low if it is a secondary hypothyroidism. Then treatment, what is levothyroxine? Basically, levothyroxine is T4. When you will take the levothyroxine, it will go to your body and will convert into T3. So just remember, we will give the levothyroxine. Then what is the prognosis? If you will start the treatment early, then there will be no deficit, because if you will delay the treatment, the neurons are going to be damaged, and that will lead to neurocognitive dysfunction, intellectual disability, or you can say a neurodevelopmental delay. So these are the important points you have to remember. Then he mentioned like avoid co-administration with soya product, iron and calcium, that I already explained to you guys. So this is the like all information, and I will like read the other information also, just to like anything new, just to have a quick review. So first of all, congenital hypothyroidism, most common cause of preventable intellectual disability. Most cases are due to, now like he's going to mention the causes: thyroid dysgenesis, and we already discussed three types of thyroid dysgenesis: agenesis, hypo and ectopy. And iodine deficiency is the most common cause in areas where especially endemic, or you can say underdeveloped countries, Europe. And then neonatally, a baby has no symptom because the mother T3T4 cross the placenta. They will go to the baby, and they are responsible for protein synthesis as well as carbohydrate metabolism in many cells. But as the mother T4 will going to be end, then the baby will show the sign. The baby physical and mental activity is going to be slow. Baby will show the sign of hypothyroidism and like lethargy, poor feeding, constipation, hypotonia. And the other very important point, accumulation of matrix substances cutaneously and internally result in non-pitting edema, which lead to puffy face. I already mentioned there is going to be accumulation of glucose, aminoglycan. These are the proteins that will, you can say, are going to be collected. Then umbilical hernia, protruding trunk, large frontales. Then T4 is essential for normal brain development and myelination during early life. So infants are increased risk of intellectual disability if they are not having especially T3 and T4 in the early years of their life. Then treatment, we will give the levothyroxine by 2 weeks, and it can normalize the cognitive and physical development. Therefore, universal newborn screening for congenital hypothyroidism is performed in United States, but not in all other countries. Definitely, like I am living in Pakistan. In Pakistan, we are not like I have seen many cases they are not like doing the newborn screening, but definitely in the developed countries they are doing. It is not like in every country, uh, and some students are from India, some from other countries. They also know about their countries very well. And then this is the information from the first aid. Now I think you guys can read out by yourself everything I already explained. All the things again going to be repeated. So this is the topic of congenital hypothyroidism. Now, like when you will solve the U-word question, especially from this topic, you will like hope so you will not get confused. So that's all